I was growing tumors in my throat and my neck, and I could not breathe. And that's the only reason. Oh, I lost 100 pounds. And
Within 6 months.
within 6 months. What was happening was every week that went by, I could breathe less and less. After a year of it just progressing and getting worse and worse and worse, I went to Dr. Kadakia's office, and he scoped me and noticed that I needed a tracheotomy immediately. So he rushed me into the hospital and performed a trach surgery and a feeding tube surgery on me, which made my quality of life immediately better. But then after the biopsies and the scans, the bad news was I had stage 4 cancer.
I was concerned about the sheer size of the tumor. And given that the tumor was involving not only the voice box, but part of the back of the tongue, I was concerned about what the best option for treating Tim was going to be.
So Dr. Kadakia tells me that it's worst case scenario. He didn't want to mince words. It was really, really bad. And he didn't want me to not know that. And that he was going to hold my hand through the entire process.
When we had a presentation at what we call our multidisciplinary tumor board conference, the group was relatively divided in the sense that there were many people that felt that surgery would be the best option for Timothy. However, given the fact that Timothy was young and wanted to try to preserve his voice box as best as possible, the other option was to consider chemotherapy and radiation for him.
His exact words were, "I can save you,
But it's going to suck.
but it's going to suck."
So my role in Timothy's care was to not only establish the diagnosis, but build a relationship with his family and help coordinate a lot of the care going forward. And after the treatment was completed, also follow up closely with him to get him to a point where he was able to survive very safely without a feeding tube and without a tracheostomy.
I needed to believe them. If I didn't believe them, there was no way I was going to keep this up. He's the kind of doctor that can make you believe something
Very personable.
that you have to believe to survive. The care that they provided for me as I was going through the radiation and the chemo was, nothing short of just amazing. I was terrified. And Dr. Kadakia and Dr. C and Dr. Severe are, I just have to say, they're experts at that. And they knew that. And they saw that. And they knew exactly what to say when I needed to hear it. And they knew that I needed to hear it. So that's what they were doing for me that entire time, is making sure I was upbeat, happy, positive.
When patients have challenging diagnoses like cancer and the cancer journey that looms over their head, having a supportive family is probably the number one most important resource that the patient has.
Outside of the premier part was what my wife and my sister did for me. I would have never in my life thought it was possible for two human beings to love you that much. And just making sure that everything is exactly the way it needs to be. And I didn't have to think. I never had to think about anything, ever.
We do use a multidisciplinary care team at Premier Health. So with that, we have a speech and swallow therapist. We have a dedicated head and neck oncology speech and swallow program here where our therapists work very closely with Timothy and his family to not only get Timothy the best speech outcomes, but also the best swallowing outcomes.
We didn't expect him to be able to talk after all the radiation. And Dr. K said, can I bring in my medical students? They have to see this. He said, they really had told us his vocal cords would be tearing up. He wouldn't be able to speak. And he said, your cords are perfect. And what a miracle, because Tim likes to talk. The staff at the Cancer Center of Miami Valley North, those ladies, oh my gosh, they just take such personal care of the patients.
I love that cancer center so much that it got to the point, and this is going to sound crazy, I miss them. I want to go. And I have to go every 3 weeks, and I want to.
Yep.
I love this team.
Aside from myself, our nursing staff, our medical assistants, my partners, the nurse practitioners play a tremendous role in the care of our patients, as do the nurses that are on our specialized head and neck oncology floors at Miami Valley Hospital as well.
And wonderful home care.
And the home care nurses were really good. Fidelity Home Care came to my house and provided for me when I had no idea how to do this myself. They did everything. I didn't even have to think. I want Dr. K to know how much I love him. I want Dr. C to know it. I want Dr. Severe to know it. I want his staff to know it. I want the nurses to know it.
Several years after completing treatment, Timothy has been cancer-free. That's the first notable outcome. Secondly, as far as quality of life is concerned, he is back to breathing through his own mouth and nose very safely, and he doesn't have a feeding tube anymore, which means that he can enjoy all of his meals by mouth. So the last point that I wanted to make with Timothy's care is how important the relationship is between a provider, the entire medical team, and the patient's family. And I think what's really important is that partnership that we gain by having an open, honest communication and by empathizing with the patient and their family.
I just love what has happened to me in the last 3 years, ironically.
Yeah,
It doesn't make sense, but I love them. They brought me back to life.
you did.